All right. So Zoe, what are we talking about on the nutrition front for hair loss?
Yeah. Well, obviously she said, I know protein, but
Yeah.
obviously that's a big one.
Right.
But a question I get asked a lot is, can I keep taking my hair, skin, and nails, or should I add in a hair, skin, and nail supplement? And for most of those supplements, if you look at the back, which has mostly biotin in it,
Yeah.
your bariatric multivitamin has more biotin and B vitamins than that Costco hair, skin, and nails. So it's just a waste of money if you're taking your bariatric vitamins as you
Right.
should be.
Yeah. At some point, taking more vitamins doesn't increase your vitamins. I've heard people talk about 10,000 micrograms of biotin for hair loss. What do you think? Yeah?
Yeah, I
Ish?
mean,
Maybe?
it's hard to say,
Cheap
right?
and probably can't hurt.
Yeah, it's not going to hurt you.
Yeah.
But, how much of that you're actually absorbing, I don't know.
Yeah. I think another thing, there's copper and zinc are big, biotin people talk about, and all of that is going to be covered by your bariatric vitamin. Iron is kind of the big, in my mind, that's the big one. And I think there's two times when when we see hair loss. The first is in the immediate phase. And to some degree, hair loss is just from the stress of surgery, right? The rapid weight loss, the stress of surgery, you're going to lose some hair in that initial phase. It tends to be temporary and people will allow it to grow back.
The physical stress that your body is going under, not the mental stress might cause some of your hair to be pulled out, but I think you were meaning like that physical stress that your body
they both.
is. Yeah.
And let's be honest, after surgery, there's both.
Yeah.
There's emotional and there's physical stress. I think another piece is that if, let's say you're a year out, 2 years out, 3 years out, and you start losing hair, that's a different cause. So if the hair loss is occurring during the weight loss phase, that's typically just the stress, and we do everything we can. I've got one more tip I'll mention at the end. But when it comes out of nowhere, essentially, that's almost always iron deficiency. So we see hair loss with iron deficiency. So if you notice your hair is thinning and you're, a couple of years out from surgery, get your iron checked. We've talked about this a lot in the past that gastric bypass patients, especially, but sleep patients too, should get their iron checked a minimum yearly. And if it's low, you treat it. Do not blow it off. Do not ignore it. It will eventually come and get you and cause way more trouble than it needs to if you ignore it for long enough. I think the other thing to talk about is that minoxidil is relatively inexpensive. And there's different doses, one for women, one for men. Truthfully, women can probably take the men's dose, but that's a topic for you and your prescribing physician. The thing you have to be careful about with minoxidil is that when you initially start it, you can actually lose a little bit of hair. And so before it starts to grow back, you can lose a little bit of hair. So if you start minoxidil right at the same time as your surgery, you could actually be accelerating hair loss. And so if you are concerned about hair loss after surgery, let's be honest, pretty much everybody is, then starting minoxidil a few months before may be helpful. And also the Rogaine supplements and things, you can put that in your hair.
Rosemary oil.
Yeah, rosemary oil. I think all of that stuff. They even have some UV light,
Oh yeah, the red light.
Yeah, the red light, right?
I have that for my face.
Yeah. So I mean, all of these things I think are reasonable things that you can do to help prevent hair loss.
And then also just to think about, like, if you do lose hair during that honeymoon period, most people see it come back after they stop that
Overwhelming
initial
majority,
weight loss phase.
95+% regrowth of that weight.
Yeah.
So that hair loss is almost always temporary. Yeah.